I'm Arthur Strauss, Arthur J.L. Strauss. I've been a member of the American Association of Immunologists since 1965. I've had an interesting career, dual career. I had, during medical school at Columbia University College of Physicians and Surgeons in the 1950s and early 1960s, I became interested in a neuromuscular disorder called myasthenia gravis, and particularly interested in the etiology and pathogenesis of the disorder. And my reading and lectures and so on directed me toward a concept that there might be a circulating factor in myasthenia gravis. Initially thought might be a quaternary ammonium compound that may correspond to acetylcholine, the neurotransmitter at the nerve muscle junction, striated muscle junction, and began with my professor, Dr. William Nastic, in the Department of Physiology, to look at trying to separate out a compound like this. But this piece of work did not succeed in finding anything of that sort. However, in the course of Dr. Nastic's perfusing myasthenic serum onto skeletal muscle, nerve muscle preparations, his preparation was frog, sartorius nerve, and rather the frog sciatic nerve, sartorius preparation, was found that myasthenic sera in properly osmotically adjusted dilutions, some sera lysed surface fibers of the muscle preparation, which seemed to afford some analogy to what what happened to red cells when antibodies to the red cells were reacted with complement to the red cells would lyse. So with that, Dr. Nastic began to study serum complement with colleagues in the Department of Microbiology and the Department of Physiology, and found that in studying myasthenia gravis, a neuromuscular disease, in the course of the disease with exacerbations and remissions, that in the course of exacerbation of the disorder, the serum complement levels fell, as if the complement might be consumed in an immune reaction, and the complement level rose again with remission of disorders to suggest that this complement-mediated reaction might had been abating. This triggered concept for us of possibly an autoimmune phenomenon. And when I finished my medical school training and my internship at Mount Sinai Hospital, I returned to Columbia as a postdoctoral fellow and looked at the possibility that we could demonstrate an antigen-antibody reaction between myasthenic serum gamma globulin and skeletal muscle. Accordingly, I had assembled a large library of myasthenic sera, along with control sera, matched controls for other people, house officers at the hospital and other individuals free of disease. And we, with the help of my colleagues in the Department of Microbiology, Dr. Beatrice Siegel and Dr. Conrad Shu, I learned the process of labeling gamma globulin or serum globulins with fluorescein isothiocyanate to render antigen-antibody reactions visible on various tissues. And on April 2nd, 1960, at the end of the day when nobody was around, I turned on the UV microscope and put various slides, those treated with a normal pool of gamma globulin labeled with fluorescein isothiocyanate and a pool of myasthenic sera patients with recent onset disease and associated thymic pathology. And lo and behold, the muscle sections from normal individuals, controls, they stayed black or dark blue. You could not see anything. Then, on the other hand, to my pleasant surprise, the sections of skeletal muscle which had been treated with fluorescein isothiocyanate labeled gamma globulins from myasthenic patients lit up in a lovely apple green fluorescence in a striated pattern. I felt like Christopher Columbus at that moment. It was very, very exciting, and I felt blessed with that discovery. And subsequently, we established and confirmed that this could be reproduced with other serum pools, and we also determined that we could detect a binding of guinea pig complement to this reacted muscle sections that is prior reacted with myasthenic sera, then treated with guinea pig complement, and then rabbit guinea pig complement fluorescein labeled, and it produced a similar striational fluorescence. This discovery ultimately facilitated my getting a job at NIH in the National Institutes of Allergy and Infectious Diseases Laboratory of Immunology, where Jules Freund had been the director for many years. It was there that I was able to continue my work for a number of years from 1961 to 1968, at which time there was a change in laboratory administration and the prospect that I would probably not be able to continue this work because of the fact that a new director was coming in who was Nobel Prize bound, and I certainly had consternation about this for myself. I did not want to be what we call in my old home, Brooklyn, a schlepper in the department, doing his fluorescent antibody work. So I immediately scrambled to look for another kind of position. I chose not to seek out a university. I'd become used to the United States Public Health Service Commission Corps, and I had a family, and I felt job security was important to me too. So fortunately, I was able to find that there was a residency program in psychiatry at St. Elizabeth's Hospital in Washington, which was at that time, the federal hospital for the insane and mentally ill for the Federal District of Columbia and other environment. And I went to visit the director of training there, and I said, could I possibly come in 1 year after I completed my work in the lab and wrap things up? And he said to me, or asked me, how about coming 2 weeks from now? So that's how I started my second career. I'm really looking to see where the advances have occurred, and I've seen some exciting things in terms of information gathering and being able to utilize information from different research sources in translational medicine, and particularly in terms of immunotherapies of cancer and perhaps immunotherapies in autoimmune diseases as well. And autoimmunity is my old stomping ground, and it's nice to see the progress that's been made since my day in the sun.